What's up, everyone? Today we are talking about scan anxiety, and it is a real thing. Okay, so basically, I have my scans coming up in less than 2 weeks now on August 28th. So, whenever you're watching this, that's when it's going to happen. Um, but about 2 weeks prior to my scans, about every single time now, I get very anxious. You want to know if it's still there or if it's not still there or if it's shrinking or growing. Like you have all of these different thoughts and it becomes like a little bit overwhelming. And I've noticed that I am not the only one that feels this way. Um, so that's why I've seen this like repetition of this term like scan anxiety or scanxiety is what they've been saying. And it's a real thing. I have started to kind of like be okay with whatever results come out, but there is still that like underlying anxiety and worry that kind of like kicks in. Even though like I tend to be on the more optimistic side, like I don't want to be in denial of my emotions either. Um, I've been in treatment for about 9 months now, and um, so far, the results have always been positive and coming out good in the sense of the cancer's been shrinking, shrinking, shrinking. But of course, because the cancer's still there, um, it gives you still that lingering anxiety of like, what is it doing in there? Like, is it having a party or is it sleeping? One of those things. And so I just want to throw that out there. And I'm a little bit nervous this coming round because I lowered my cancer medications, my dosages. I lowered my dosages. And I was pretty skeptical about doing that. There was a lot of emotions, but um, I'll kind of let you know a little bit of the story why I chose to do that. So there was a few instances where I was taking the 125 milligrams of Ibrans, and I kind of lost consciousness a few different times after taking the medication. And I was very hesitant to kind of tell my doctor because I knew that it was working. Like I knew that the treatment was working. And so I was really hesitant. However, it is very scary to kind of lose consciousness because you're that fatigued um, after taking the medication. And it would not happen on the first 2 weeks, but it would happen on that last week. So I'm not sure what was happening in my body, but we did lower the dosage. We lowered it from 125 milligrams to 100 milligrams. So in addition to that, I was having really, really bad bone pain. Like even if I was sitting down or laying down, um, my bones would just be aching. Like everything would just be hurting. I was experiencing a lot of pain. And so my doctor said, "Okay, we're going to lower your Lupron." So I'm taking a few different medications. One of them is Lupron and Femara, and it's like, well, Femara is like letrozole or whatever. Anyways, hormone therapy as well. So we lowered the Lupron dosage, which again, these are like cancer fighting, drugs. So I was very hesitant about doing this, but also I was really struggling. And so that is the reason why I reached out to my doctor and had my medication dosages decrease. So I'm a little bit nervous about my results because I did lower my cancer medication dosages. Anyways, that's why I'm nervous. So I'm gonna keep you guys updated. But scan anxiety is real. Scan anxiety is a thing, and I'm just gonna put this video out there very raw, real, and unedited this time, so that you guys can just see like kind of what it's really like, unfiltered. And that's my plan. And that's it. That's all I got for you today. But have See you next time. There we go. We'll just leave it at that. See you next time. Bye.